Hey, good morning, everybody. So, I wanted to get on here and talk a little bit about our healthcare system, me getting trying to get employment for healthcare, and what I really believe about our healthcare system. And then the I've applied to a few jobs this morning and this week, and I'm just looking at it like, because I was watching a video this morning on YouTube talking about how bad our healthcare system is. And it's not anything I've never heard about before, because unfortunately, with all the things that I've seen in our healthcare system, it's sad. It really is. I have worked as a family caregiver, and then behind the scenes, I have, like, I've taken care of my dad, who was a cancer patient, and then my mother, who has dementia, and then there's just so many other things that I've seen, like with my own health. When I've been to the clinics before, I used to go to this clinic on the West Bank, and that was a part of Arsenal. And because I had to go to the clinic several times, 'cause I had a serious sleep disorder, and I still do, but mine is more related to fatigue because of my iron level, my hormones, and then, like, the overall, like, behind the scenes of what I think that patients go through as far as to seeking healthcare. It is very sad because I feel like the clinics that I've been to and I've seen, like, doctors and nurses work, and it's incredibly sad how our healthcare system has been. Um, my dad was seen by a cancer doctor before, and I remember having to go, and because, he wanted chemotherapy, and chemotherapy, as everybody knows, chemotherapy is one of the most expensive treatments that a lot of patients get. And then my dad never got radiation. The doctor said it wasn't needed, and she stated that he had cancer that was already, it was already spreading to his whole body. And so she said there was nothing that she could really do, which was very discouraging. Nonetheless, I felt like she was the worst doctor because she really didn't put, like, a lot of people get into this field because of the money, and it's not healthcare. I always believed, I mean, I think about it a lot. Healthcare is, when you're working in healthcare as a healthcare professional, your job, your main job is to care about patients. And unfortunately, we live in a very broken world, not to mention, not just broken, but, a lot of a lot of nurses and doctors, I'm not saying all of them, but majority, some of them are very rude. They don't care about how the patients feel at all. When you're going into a field like this, you really should take the time out to care for patients. That's one of the reasons why I had applied for a healthcare position, is because I really do care about people. I care about the patients. I care about people who come, because, in the area that I live in, New Orleans, right now, there are a lot of people that can't afford for, like, health, insurance wise. And I understand this because I'm going through this myself right now, where, like, I've had to, I don't know why, because I've never had Medicaid decline, and then they looked at how much I was making, and then all of a sudden they kicked me off of Medicaid out of nowhere. And then I'm stuck with Obamacare, which I hate. I hated Obamacare. I don't think anybody ever did. And then now I'm back to square one where I had to reapply again, and now I'm getting Ambetter, which I really don't like Ambetter at all, to be honest. And so, like I said, a lot of people get into certain careers and they think, of course, people think about the money, and then they think about, that they don't take the time to really build up the skill of dealing with patients. And that's one of the biggest things that I feel like people really need to take into consideration when getting into these fields, because I look at hospitals, and I just feel so incredibly sad for these patients, because both some of the most of the time that I've walked in the hospitals, because my mom's been in hospitals a lot of different times, is that they truly don't care. And it's incredibly sad to see and to watch that, because that's a part of their job. That's one of their, you know, it should definitely be one of their rules to follow, and really take take the time to doing that, because we live in such a world where it's just like that people just don't care, and they don't take the time to sit there and do the things that they need to do to take care of patients who are sick, who don't have the ability to function like they used to. There's a lot of patients out there that just don't. They're very, that we should be wanting people in the field to be able to help take care of patients and live a better quality of life, because that's what healthcare is really all about. And it's sad. It's really really sad to me to see this whole epidemic that's been going on in America. It's really really sad. And that's not even just for, the people in my culture, which is, Vietnamese people, who Asian community, who have to deal with this. And not to mention, not only Asian people who had to deal with this, but the black community that have to deal with this, or the white community. I mean, these are people who are dealing with so many different things, different angles, that have to go out and go into a system like this. We should have never had to go through all this, but unfortunately, in the American uh, healthcare system, it's really corrupt. I really don't like the laws behind it all. And of course, the laws are to keep the patients, to protect the patient. But unfortunately, like I said again, most doctors and nurses who are out here are just looking to find ways of how to profit, but they're not looking ways of how to achieve, like, help patients to achieve better healthcare outcomes. That's my biggest thing of why I did this video, is because it's important to do that, because without that, a lot of people would definitely be in bad shape. And that's the world that we're living in. It's sad. I do pray upon that God, helps out those people, especially in New Orleans, who are going through those times. And I'm not saying, because it's everywhere. It's not just New Orleans. It's, Texas. It's, everywhere in the United States. I'm pretty sure it's even in Washington D.C. I wouldn't be surprised. I mean, they may have better quality. Just being able to have the money and the funding to be able to see doctors and nurses. And it's important to take care of your health for the main part. It's incredibly sad to see this happen. But like I said, just keep I want to keep praying, and just wishing everybody if you haven't had a good week, which to me the weather was horrible this week, I pray that your week ends up by this weekend to being the best week. I didn't get much sleep yesterday because I had a horrible stomach cramps, and I was just not feeling my best, and then I couldn't sleep that well, and I knew I wasn't going to sleep well either way because I was out of my medicine and I wasn't feeling well. But by the end of the week, I'm pretty sure I'm going to go to the doctor and just get my hormones checked out. I already made an appointment, but I just want to share with you guys that no matter what happens in life, keep going through it. And sometimes, like for me, I get doubtful, I get fearful, but then when I look back at on it all, I know God is still working in the midst of this whole, you know, pandemic world or whatever, world we're living in right now. But don't forget, to really stay true to yourself and always stay humble, people. All right, you guys, have a great week.